Welcome back, Straight Talkers. Today I'm going to talk about the medication dextroamphetamine so that you can be better informed when deciding whether or not to start this medication. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. So dextroamphetamine is the generic name, and the various brand names include Zenzetti, Procentra, and Dexedrine. So how does this medication work? Dextroamphetamine is a stimulant medication, and it works by increasing the activity of the neurotransmitters dopamine and norepinephrine in certain parts of the brain. In adults, dextroamphetamine is FDA approved for the treatment of ADHD and narcolepsy. It's also approved for the treatment of ADHD in children 3 and older, and narcolepsy in those 6 and older. It's used off-label at times for the management of obesity and treatment-resistant depression. So when looking at dextroamphetamine, it comes in many different formulations. Zenzetti is a short-acting tablet. Procentra is a short-acting liquid that comes in bubblegum flavor. And Dexedrine is an extended-release capsule. The short-acting forms are thought to last between 3 to 6 hours, while the long-acting form lasts around 8 hours. For the short-acting forms, dextroamphetamine is generally dosed between 2.5 to 40 milligrams daily, and this is usually divided into 2 to 3 times daily dosing. And for the long-acting form, dosing is usually only once daily, and the range is from 10 to 60 milligrams daily. The long-acting capsules contain beads that are 50% immediate release and 50% sustained release. And because we don't want to mess up the release system of the long-acting form, these capsules should not be crushed or chewed. However, they can be opened and sprinkled over food, such as applesauce. And if I'm using this medication in kids, my approach is always to start low and go slow, meaning we start at a low dose and increase the dose gradually and slowly over time with the goal of finding the lowest effective dose. Now let's talk about potential side effects. It's important to realize that many side effects are often dose dependent, meaning that the likelihood of getting them increases as the dose increases. Other side effects are also time dependent, meaning that they begin immediately upon starting the medication or whenever we make a change to the dose of the medication. But what we typically see is that they'll go away with time as your body gets adjusted and used to the medication. The common but usually more mild side effects of dextroamphetamine include increased heartbeat, decreased appetite, weight loss, tremors, headaches, trouble sleeping, dizziness, upset stomach, and dry mouth. The more serious but less common side effects can include slowing of growth in children, seizures, cardiovascular events, or eyesight changes and blurred vision. Thanks for watching this video. Now head on over to the next one to find out more ways that you can help your child live their best life.